I'm with Ron Kurtz, founder of Hakomi. Hi, Ron.
Hello, Serge.
So, a lot of people in our audience obviously know Hakomi, and many have been trained in it, but some people may not know it as well. Would you maybe define a little bit what Hakomi is?
Well, Hakomi uses several particular or unique approaches to helping people study themselves. We believe that, or I believe anyway, that self-study, as it's practiced even in the East, is really about reducing the unnecessary suffering that comes from not knowing who you really are. In fact, Hakomi means who are you? That's what the word means. So, the way we do it is to establish a kind of safe relationship, a bubble sometimes we call it, within which the therapist helps the client feel comfortable and safe and cared for. And that's done by training therapists to be in the right state of mind when they work. And that state of mind is very similar to what Buddhists might call compassion, or we call it loving presence. To have a loving feeling about the person which you actually practice developing, and to be totally present. And to be totally present is to be aware of the facts of the moment, to be aware of what's happening, actions, physicals. That relates us to body-centered psychotherapy. We're constantly aware of the bodily signs of the client's present experience. We're interested in accessing the client's implicit beliefs, the beliefs that are operative through the client's habits. And we see the signs of those behaviors. We see the signs even of some of those beliefs in the person's present behavior. We don't generally think about taking a history. We don't listen very much to what people try to explain to us about themselves. We just use this method to help the person realize who they are, how they organize their experience automatically.
Yeah. So it's really, as you said, who are you, and who are you in the sense of how you organize your experience.
Yeah, and how you do it unconsciously, automatically. The things that go on, as John Lennon would say, while you're doing something else. There's wonderful new books about the adaptive unconscious, and that's an essential part of my thinking.
That most of the processes happen unconsciously, and there's a reason behind that.
Yes, there's usually a habit that was learned as an adaptation to a situation, or habits that were learned, and they're not necessarily verbalized or even aware. We have to bring them into consciousness, and sometimes they'll come in as a memory or an emotional reaction, and then we have to spend a little time getting the verbal descriptions of it. You know, a child will learn the grammar of its native tongue by the time it's 18 months old. But it cannot tell you about nouns and verbs, but it uses them perfectly. That's the kind of adaptations I'm talking about. So we work with surface indications of those adaptations. I'll give you a very simple example. There are people who interrupt themselves when they're speaking, as if they had an editor who was watching what they said and would stop them and make them change their words. Well, That's an indicator. That's immediate behavior. It happens with this person almost all the time. And it's an indicator of either something like trying to avoid making a mistake because they were punished for making a mistake. So we can go right to that if I just listen to a person for a minute or two and see that behavior.
Mm-hmm. So really what's happening is you're not paying a lot of attention to the story of people's lives, but really focusing on how they are and tracking what you call indicators.
Indicators, exactly. You know, Reich said that the client's history walks in with him. It's the way he shakes your hand, and holds his body. The adaptations are written in the posture. They're written in the muscle tension. And that the kind of posture where a person looks at you with a slight angle of their head. They don't look directly at you. That's an indicator, a postural indicator. So, as in bioenergetics and Reichian work, locked knees are an indicator of orality, or a puffed up chest, indicator of a psychopathic personality. So, all the character patterns, to me, are a subset of indicators. And these indicators are indicators of implicit beliefs.
Yeah.
Like the puffed up chest, I have to be tough. I can't let people in, I can't be honest with you. All of those things are written in the posture. So you know how to read it.
What the posture tells you, it's an embodiment of the belief.
Mm-hmm.
And as you...
But the belief doesn't come first. The adaptation comes first. The belief may not even be conscious. It may never have been verbalized. I had that happen in Australia a couple of weeks ago. I get feedback. They're shocked that these beliefs are there, but they recognize it.
Yeah. So this unconscious beliefs, this result of the adaptation, the unconscious adaptation, it takes a special kind of attitude on the part of the therapist to notice it.
And the client.
And the client.
The client has to be devoted, to this idea of self-study. They have to be willing to allow the therapist to do experiments which will evoke some of these early painful situations. Either they'll come up as an emotion first, where the person just gets emotional and you know why. And then a little while later, they start to have a memory that fits that emotion.
Mm-hmm. So you use
the courage to be a client.
Takes courage, yes. You use the term experiment. Do you want to talk a little bit about this concept of experiment?
Absolutely, yeah. For example, I was giving a talk at the psychology conference in Vienna one year, and I had maybe 200-300 Germans and Austrians there, mostly. I asked them to become mindful. I gave them some time, and I helped them work themselves into mindfulness. And I asked them to say, well, first I told them that I'm going to give them a statement while they're in mindfulness. And I told them what the statement would be. I was going to tell them they were a good person. In German, that's du bist ein guter Mensch. And I was asking them to tell their neighbors, tell your neighbor what you think your reaction will be when I say that to you and you're in mindfulness. So they talked about that for a moment. Then they got mindful. And then I said it to 200 people. Right? Well, 80% or more had mispredicted. They didn't know what their reaction would be. About 60% of them got suddenly sad. And some got teary-eyed. And some felt relief. And of course, it's because there's implicit beliefs around in those cultures that we're not good people. So that's an experiment. I study the person, I study their indicators, I make a guess about what the beliefs are, and from that guess I create a test. I create an experiment which I hope will evoke reaction that has significant information for that person about who they are.
Mm-hmm. So that's a very, very much related to that notion that Hakomi is about who are you.
Yes.
And by creating the experiment, you give a chance to the person to actually realize the belief they carry inside.
Yeah. Sometimes we call it self-discovery.
Mm-hmm.
Assisted self-discovery. That's the way I like to think of it.
Yeah, so that's a very different approach from more medical-oriented model of pathology and...
Yeah, it's totally not pathological model. It's the model of, if you want to study yourself,
And you mentioned several times the word mindfulness, and that it's very much part of the way the experiment functions. Could you talk a little bit more about mindfulness?
Yeah, traditionally, mindfulness is the method for self-study in meditative practices, Buddhist practices. Mindfulness is a state where you're focused and concentrated on the flow of your experience moment to moment, and without, as much as possible, without interfering with it. For example, it takes years of practice, but some people can watch their breathing without interfering with it. That's the mindfulness.
Mm-hmm.
And it's one of the ways they train mindfulness is pay attention to your breathing. So the idea that that there's no organization around controlling it. You're not controlling what happens next. So if I say something while you're in that state, it directly evokes a reaction. You're not protecting yourself against it. You're allowing these things to happen. And that's one of the reasons that there has to be this connection with the client, where the client understands and feels the compassion of the therapist.
Yes.
They're taking chances.
So in the example you were giving earlier of this talk where you had asked a question to the audience, and their inability to, in most cases, to predict how they would feel, the reason is that they had not been connected to themselves, and in mindfulness they suddenly had the raw experience.
Yes, you could say that. That's true. And the reason I chose that sentence, that statement, you're a good person, is I understand the culture doesn't promote that.
Mm-hmm.
Culture promotes original sin, and you're a bad guy. So I just guessed that would work. In other cultures, I use different ones.
Yes, and obviously, as you said, when you're dealing with a client, you pay attention to who the client is through these indicators.
Absolutely. And then the statements I offer the client, or some other kind of physical experiments I do too, are designed particularly for that client at that moment.
Mm-hmm. So in order to reach that moment where the client is able to be in a mindful state, you mentioned that the attitude of the therapist includes compassion, the loving presence.
Yes. Uh-huh.
How is it that you help somebody who is not especially prepared, trained in mindfulness, to become mindful for these experiments?
Well, almost everybody can do it for a moment or two. Almost everybody. You'd have to be quite wired up and nervous not to notice something. And so most people can do it. And of course, clients, once they have practiced a little bit, it gets easier and easier. The key to it is, you might call it limbic resonance.
Mm-hmm.
By my, or any Hakomi practitioner, by timing, by pacing, by being silent when the client needs you to be silent, by noticing things, and simply, what I train my students to do, I say, when you sit down with somebody, study them for what you like about them, study them for what makes you feel good, and that will be reflected in everything you do. So, they're trained to do this. So they look at somebody and they'll just start liking this person, or how beautiful they are, you know. They're all beautiful somehow. Everybody was somebody's baby, you know.
So just what I'm hearing is that if we make mindfulness something that's intimidating, then it's going to be difficult. But if we focus on the fact that most of us can access mindfulness for a few seconds, then it's much easier. And that what happens is that the therapist actually helps the client, eases the client into that mode by limbic resonance, by focusing on what they like about the client.
Yeah, that's true. And I may not even mention mindfulness to the client. I might just say in a very soft voice something like, well, why don't you just go get as calm as you can get, and I'll say something and you notice what happens when I say it. You know, just as simple as that, and that works. You don't have to know about mindfulness. They just have to get calm and study their experience.
Yeah. So very much that sense of just being in the moment and creating the present experience.
Yeah, exactly. Studying reactions, you know, studying reactions for information, for what it tells you about who you are. And there are people who are too nervous, they had too much coffee or something like that, and they can't get into mindfulness right away, so they have to do something else. Get a massage, take a hot tub, then come back. Something like that. But I've only run into maybe 2 or 3 people in a career, a 30-year career, who couldn't do it. Now that's how easy it is.
And maybe it's a testament to how wired we are to resonate with other people if the therapists themselves are able to create some of that.
Absolutely. You know, sometimes we'll trigger a traumatic memory. And in times like that, because you have no idea what's going to pop up when you do an experiment. You've got an idea about an indicator, you do an experiment, and the person can go right into some kind of traumatic memory. Those cases, I talk very softly and gently and calmly to the person. I have them look right in my eyes. I hold them with my vision, you know, and my softness. And I talk to them about, you know, you've been hijacked by a memory. You know you're really safe right here, right? You know, it's just appeal to the rational mind. And that seems to help them come around quite a bit.
Yeah. So very much instead of talking about relationship, you are in relationship at a very, very basic limbic level.
Yeah, that's true. Yeah.
And what is it that helps therapists practice be able to offer that kind of loving presence?
Well, that's a good question. Well, for me, it popped up many years ago when I was working in Germany, and I had done 9 straight days of therapy sessions in a group over and over, and I was exhausted. And I was so tired I couldn't think very well. So I just stopped thinking for a while, even though I didn't tell the client. I didn't interrupt the client or anything. They were just talking, and I sort of went blank. And in this blank state, looking at this person, I saw a certain kind of beauty in this. And I realized if that person knew that I was seeing this, they would feel it. And I realized it shows. I'm looking like I'm feeling this. So I asked the person to look at me. They had their eyes closed. He had his eyes closed. He looked at me, and immediately his process changed into something deeper and something emotional. And that's when I realized, oh, yeah, that's the basic engine of the relationship. It's just appreciating this person to the point where you feel compassion, or you feel loving towards them, and that will move the process by itself.
And so this...
That I get plenty of that for myself, too. I have a wonderful family. It sustains me.
Yeah, so in other words, it would be very difficult to offer this kind of sustaining presence to clients if you didn't experience it yourself in your own life.
Yeah, you have to find a source for all of that. You have to find the beauty in everything, sweetness in everything. You have to be really careful about getting hung up on what's wrong with the world. Just love.
So maybe that's also related to mindfulness in the sense that it's about the ability to focus or not focus on some things.
Yes, right. Sometimes it's called concentration training. You do that too.
So
there's the ability to be focused in the present. Yeah.
So as you are, as a therapist, has this sense of loving kindness. The client is tracking the client's reactions, discovers indicators, conducts experiments. What is it like for the client to go through that? You mentioned earlier there is a certain sense of courage. It must take, a certain kind of client to take this, or is this something that's applicable to everybody?
I think almost everybody. But there has to be a willingness for self-study. There has to be a willingness to take an honest look at yourself. The experience for clients, we think of it this way. If they adapted to a situation that is still painful to them in some way, or still running them in some way, defensively, or compensating, they didn't get a certain kind of mental, emotional nourishment that they needed. There was something missing. We talk about the missing experience. And and it's missing because either they don't believe it's possible or they feel they have to defend against it. Like, for example, we can do an experiment where I ask the person, be mindful to watch me, and I'm going to start moving my hand very slowly towards them as if to touch them, and they should notice their reaction. Well, that will trigger a memory of being, if they had been abused, it's typically going to trigger that. And what's missing for them is this perfectly gentle, sweet touch. That is, and so when they realize that they become emotional, and then they can allow the hand to touch them, and they can feel the sweetness. They can feel it, what's been missing for years and years. And that missing experience is so delicious and so healing that once you experience that, or even if you just see that happening with somebody else, like when I do therapy intensives, very often, and maybe there's 20, 25 people out there watching me, 5 of them are going to be crying in somebody's arms when I'm done. The people watching get moved because they have similar issues. The issues are very general. The nourishment that was missing is just like in German,
So maybe that's something I would want to make explicit, is that we're talking about something like experiment and using an analogy with a scientific process. But the end of it, the moment of change, the moment of healing is the emotional healing that happens when people connect to that missing experience.
Exactly.
So, this emotional healing, could you just described something that happened in a workshop. Could you give some experiences, one recent example of an experiment and the kind of missing experience that it revealed?
I think very often I'll tell somebody, well, there's a little bit of technique involved here to evoke these memories and to evoke the emotions and events. But I remember working with somebody, a psychiatrist. No, I think she's a doctor, just a medical doctor,
Mm-hmm.
who had been severely abused. And we worked several sessions until she reached a point where she was containing her rage and couldn't release it.
Mm-hmm.
It would just choke her up in her throat. Okay, so I said, well, you come back tomorrow, and I'll have 3 people here, beautiful people here, to assist me, and we'll contain you. So we did that. She came back. We brought her right to the same edge, and they were holding her very tightly.
Mm-hmm.
Because she would contain herself if she was alone. But when she reaches the point the second day, I have people hold her very tightly so she can feel safe enough to express herself. Well, she goes into this rage, and it I don't know how long it lasts, but I have a tape of it. It probably lasted at least 5 or 10 minutes. No more than 10, but at least 5.
Mm-hmm.
And afterwards, after this explosion, she lay down with her head on one of my assistant's laps, and she was feeling really great. She released that, and there was kind of a sweet melancholy about it all.
Mm-hmm.
And she looked at me and she said, I never did this before.
Mm-hmm.
She never let herself be comforted before. Never rested her head in somebody's lap before. That's delicious.
Mm-hmm.
Yeah.
So, one of the things...
That's a question, but that was the answer.
Yes. As I was asking you to relate an example of that, and what's become very apparent in this example is the role of containment and support, including physical support.
Yeah, exactly. That's still part of the body-centered aspect of it.
So, where other people see things in terms of resistance, you actually support people.
I see it as emotional management behavior, experiential management behavior. So I'm going to help them manage it. I'm not going to support their behavior, and so that they can relax a little bit. Let me help them, and then what they're managing has a better chance of coming through as expression.
So in other words, you don't go into a battle with the clients into describing a behavior as dysfunctional, but you see it as the way they are managing their behavior.
Yes.
And as you help them, something else happens.
Absolutely. It's amazing. That we call that technique taking over. We take over the person's defenses or his management behavior. Like, for example, if I give somebody a probe that says you're a good person, and they hear a voice that says, no, I'm not. I mean, they have a thought, right? No, we'll have somebody take that over, because that's a management behavior.
Yeah.
They're managing their fear of thinking of themselves as a good person. Now, that's not a good idea. So I have somebody take that over. So I say it again a few times. You're a good person. And this assistant of mine says, no, I'm not. And the person is again in mindfulness. And as we do this 2 or 3 times, very often, there's a memory. Okay, a memory comes up about where they learned this adaptation. And once you got it in memory, it's changeable. Once they see why they did it, they have some more control. They can change it. They can change their behavior. But they have to understand it first. You can't force it to change. It changes through insight.
Yeah.
And practice.
So the words insight and practice are very evocative also of Buddhist practice.
Absolutely, yeah, that's right.
And that I assume that is an area where some of that wisdom, some of that approach has permeated into your approach and your methods.
It was there from the beginning. I was enamored and studied Buddhism in Taoism long before I started doing Hakomi.
Mm.
So it's part of the inspiration for the method.
So I would like to use the word inspiration to say that this has been an inspiration. Unfortunately, we're coming to the end of the interview, but maybe I would like to suggest to people who are hearing this to carry with them some of this compassionate and experimental attitude in their work.
Yeah. Try loving presence.
Loving presence.
You'll get far.
Thank you, Ron, for your loving presence.
Courage, it's a pleasure.
This recording is part of the Proactive Mindfulness podcast. We explore how to be more present and engaged in our lives and how to make lasting change. This is a contemporary take on mindfulness informed by embodied therapy and the polyvagal theory. You can find more articles and videos on the website proactivemindfulness.com.